What is autism? Autism is derived from the Greek word autos, meaning self. A child with autism is frequently referred to be living in his or her own world. Autism is a lifelong neurodevelopmental disorder characterized by marked difficulties in social communication and social interaction, restricted or repetitive behaviors and interests, and sensory sensitivities. Today, conditions like autistic disorder and Asperger's syndrome, once diagnosed separately, are known as autism spectrum disorder, or ASD for short. ASD is described as a spectrum disorder as severity and intellectual ability differ for every child. Some lead relatively normal lives, while others need long-term specialist support. What causes autism? Despite the many theories, there is no definite answer. Nonetheless, research shows that the different factors, including genetic and environmental factors affecting a child's brain development, can cause autism. What is the prevalence of ASD? ASD is 4 times more common in boys than in girls. Based on a prevalence rate of 1 in every 100 in studies conducted overseas, Autism Resource Centre Singapore estimates that there are 50,000 individuals with ASD in Singapore's population of 5 million. What are the early signs and symptoms of ASD? Developmental red flags that demand professional attention include not smiling or displaying other joyful expressions by 6 months, not exchanging sounds or facial expressions by 9 months, not responding to his or her own name, babbling, or exchanging gestures like waving by 12 months, not speaking in words by 16 months, and not initiating meaningful two-word phrases by 24 months. Other early symptoms include the lack of pretend play, sensitivity to everyday noises like the hairdryer, and repetitive movement. How is ASD diagnosed? According to the DSM-5, an individual should present the following to be diagnosed with ASD: persistent deficits in social communication and social interaction across contexts, and restricted repetitive behavior, interests, or activities. Symptoms must be present in early development, cause significant impairment in social or other crucial areas of functioning, and are not better explained by intellectual disability or global developmental delay. What are the long-term outcome and treatment options? To date, there is no cure for ASD, although medication can help some function better. Nonetheless, research has shown that early intervention can greatly improve the child's development. Let us look at 3 evidence-based interventions available for children with ASD. Aim for children with ASD. Enabling individuals with ASD to function meaningfully, productively, and as independently as possible is the aim of interventions. What is structured teaching? Structured teaching is a social cognitive behavioral approach applied to the neuropsychological characteristics of ASD. Structured teaching refers to instructional strategies and environmental supports for individuals with ASD developed by the TEACH program, a statewide program for individuals with autism in North Carolina. Goals of structured teaching. Structured teaching has 2 main goals. Firstly, teach the individual with ASD as many skills as possible given his developmental level, and secondly, provide an environment as comprehensible as possible so the learner can understand the expectations and opportunities around him. Putting the principles of structured teaching into practice. Structured teaching provides visual information and physical organization of the environment to answer 5 questions for the learner. First, where should I be? Second, what work or activity will I do? Third, how much work will I do? Fourth, how will I know that I am making progress and when I have finished? Fifth, what will I do next? What are the elements of structured teaching? There is an emphasis on organizing the environment and spaces because of the distinctive ways that individuals with ASD think about, understand, and act on their environments. First, physical structure. Spaces are organized to decrease the visual and auditory stimulation that can be distracting. Areas are defined to provide clarity and order. The structured physical environment can also reduce anxiety, which has a direct impact on a student's behavior and ability to learn. Second, schedules. Schedules allow individuals with ASD to know where they are supposed to be and what they are to be doing at a given time, and allow for predictable environments with knowledge of what will come next. Schedules should be individualized, visual, accurate, and easy to alter should the need arise. Third, tasks and work or activity systems. Tasks and work or activity systems visually show the child, from the very beginning of the activity to the finish, what items he is being asked to complete and how he will see that he is making progress. Each task provides this information about the process of working on a task or a series of tasks. Fourth, visual information. Visual structure provides the student with information about how to complete a task and how to use the required materials. Visual clarity draws and engages the student's attention to important and relevant information. Tying it all in. Structured teaching is an autism-friendly way of organizing and presenting information to individuals with ASD. We now look at another evidence-based strategy, social skills training. What is social skills training? Social skills training is a collection of practices that use a behavioral approach for teaching children appropriate social skills and competencies, including communication, problem-solving, decision-making, self-management, and peer relations. Examples of social skills trainings target: first, manners, how to approach others in socially acceptable ways, how to ask for permission rather than acting impulsively. Second, friendship, how to make and keep friends, how to share toys and materials. Third, conflict resolution, how to seek help from others, use words instead of physical contact, choose positive, non-aggressive choices when faced with conflict. Fourth, feelings, awareness of own and others' feelings, coping with negative feelings. Fifth, appropriate classroom behaviors, listening skills, following directions, seeking attention appropriately. 6. Anger management, counting to 10 before reacting, learning internal dialogue to cool down oneself. How to teach. First, capitalize the strengths of the individual while specifically addressing their deficits. Second, break down complex social behaviors into concrete steps and rules that can be practiced in a variety of settings and with different people. Third, use a variety of visual, tangible, hands-on activities that make socialization fun. Fourth, visual structure and predictable routines are essential. Fifth, generalization through community outings, skill practice in more naturalistic settings, and collaboration with parents are encouraged. Ours is a social world. The abilities to play, learn, interact, share space, exhibit appropriate behaviors, build relationships are important skills to navigate successfully every day. The last evidence-based strategy we will look at is sensory integration training. Sensation, that is what we can see, hear, feel, smell and taste, gives us information about the environment around us and about ourselves. It helps us understand the world and how to act on and within it. In order to make sense of all the sensations we experience, they must be integrated. Many children with ASD have sensory processing difficulties. They often experience challenges in the home, community, and school setting. This might be seen in children who have, first, visual oversensitivities that are difficult for others to comprehend. Second, overly sensitive sense of smell. Third, abnormally strong dislikes for particular tactile sensations. Fourth, difficulties in body awareness, grounding, and balance. Fifth, vestibular hypersensitivity or a low tolerance for activities that involved movement. 6. Hypersensitive taste. 7. Difficulties in auditory processing and hypersensitivity to sound. The sensory system has a tremendous and often negative impact on the behavior of children with ASD. These children frequently seem anxious, display emotional outbursts when unsuccessful, are inefficient at accomplishing tasks, demonstrate poor frustration tolerance. So, what is sensory integration training? Sensory integration training incorporates unique sensory experiences into the child's day, which provides a huge vestibular input that can calm sensory seekers for hours. Because children with sensory processing issues often don't know where they are in time and space, activities that provide proprioceptive input can help give them the grounding and increase body awareness. Every child brings a unique story. The number of children with ASD is increasing dramatically. There is overwhelming evidence that earlier is better, both in terms of ASD diagnosis and intervention. ASD is a spectrum disorder That means that children who receive the diagnosis may differ in their abilities, preferences, needs, and areas of strengths and delays. There is no typical child in ASD. There is no one right way of educating a child with ASD. Every child and family brings a unique story to the early intervention process, and that story must be woven into a fabric of intervention and support for the process to be effective and successful.